We are going to return to the First Minister's meeting on healthcare next month and what the provinces will be pushing for and how hopeful they are that their message will be heard. Heather Stefanson is the Premier of Manitoba and Chair of the Council of the Federation. She's in Winnipeg. Premier, thank you very much for speaking with us. What are your expectations heading into this meeting?
Well, first of all, I just want to say that I was very pleased to get a letter from the Prime Minister this morning indicating and calling for a First Minister's meeting. You'll know, Katie, we've been asking for this as premiers across the country for some time now. And so I think that this is a good day and I think a step in the right direction. And so we're very pleased to be able to sit down finally and have this discussion.
Provinces have been pushing for a significant increase in Ottawa's contribution in healthcare costs, bumping it from 22% up to 35%. Do you expect the federal government to meet that demand?
Well, I think we haven't seen any proposal from the federal government yet, and so I'm very much looking forward to seeing what that proposal looks like. As I understand that the Prime Minister will be delivering that on February 7th, so we look forward to seeing the details.
You don't have any heads up ahead of time how far they're willing to go?
No, I really don't have any indication yet, but that's why it's so important for us to be able to sit down and have that discussion.
Health Minister Jean-Yves Duclos was speaking to reporters today, and he pointed out that many provinces are actually either looking at or approaching budgetary surpluses. Should the responsibility be with those provinces to reinvest into healthcare rather than rely on Ottawa for additional funding?
Well, of course, we know, Katie, that the level of funding for healthcare has been increasing and taking up more of our provincial budgets and territorial budgets over the course of the last number of years because of healthcare cost pressures. And so we want to ensure that we still have those monies for education, social services, and as well right now, something that's very significant, Canadians, is affordability. And we want to ensure that in these inflationary times, these inflationary pressures that Canadians are facing and Manitobans are facing, we want to make sure that there's a balanced approach to that.
So what do you say to the health minister when he says, you know, it's worth pointing out that a number of provinces are either looking at or getting close to a surplus?
Well, again, we're calling on the federal government to be a fair partner in the delivery of healthcare when it comes to the funding of healthcare. So that doesn't change, and we'll continue to push forward those points at our February 7th meeting, which I'm looking forward to having those discussions. We haven't been able to have those discussions yet, other than, you know, through the media. And so I think that this is a positive step in the right direction. And I think, frankly, this is what Canadians have been wanting us to do for some time. And so finally, we're able to do that.
So you say fair. What looks like fair to you?
35%.
Is that straight up? You know, is that like a hard line for the premiers that is that sort of a deal breaker? If the federal government can't come to the table with a 35%, that, you know, it's just, is that a deal breaker?
I think we've been very clear where we're at, and now we're looking forward to seeing their proposal. And that's, you know, the start of the discussion that will take place on February 7th. I don't want to predispose what could happen at that meeting, but I think that it's really a start of a conversation that can take place there. And so we'll see where it goes from there.
The Prime Minister also spoke today about how in this approach to trying to find solutions when it comes to healthcare, that some provinces might need different solutions when it comes to perhaps one province needs more help with mental health and addiction issues. Another province might need more when it comes to I believe another example used is family doctors. Are you concerned that everyone will get a fair deal and there could be friction between the provinces if there isn't some sort of blanket sort of solution here?
Well, I think that's really why, as premiers, we are asking for that bottom line funding for the Canada Health Transfer to increase up to 35%, because it allows for us as provinces and territories to decide what is the priority within our own jurisdictions. And so that's really what, you know, we have been asking for. We look forward to, again, sitting down and having that discussion.
One thing that a number of your colleagues have announced in recent weeks is trying to reduce backlogs when it comes to surgeries, when it comes to wait times. And a number have announced, Ontario and Alberta, for example, is the expansion of access to services at for-profit centres. What is your vision of how an expansion of that kind of care? Do you see that as a solution from the Premier's perspective?
Well, right now it is something that is part of our healthcare system across the country is private delivery of healthcare within a single payer system, right? So your health card is your ticket to healthcare in our province and in provinces across the country. And so I think when we're looking to expand capacity, which is something that we found during the pandemic, is that there was shortage of capacity. When we're looking to expand the capacity within our healthcare system, I think it's prudent not to put an ideological lens on that, and we need to look at private delivery of healthcare services as well as part of that, as part of expanding the capacity of healthcare in our country. Still, again, within that single-payer system.
So as long as it stays within that single-payer system, you think there are avenues for expansion, innovation? You're looking to this sort of as a solution.
Yes, absolutely. Innovation in healthcare is something that we're looking at, I think, right across the country. I know it's something that we've looked at here in Manitoba and we've started to act on here in Manitoba. I think the important thing that Canadians want is to be able to get the diagnostic and surgeries that they need when they need it. So I think they're wanting us to be innovative in terms of finding solutions to some of the challenges that we're faced with, the backlogs in the system.
Is it from your perspective, do you think the federal government's on board with that view?
I can't speak for the federal government if they are or not. Yeah.
Fair enough. There has been some criticism of these announcements that have come out. Well, this kind of care is not new. It's being expanded. Do you see this as a slippery slope that this could be headed towards a change in the fundamental way Canadians get health care? Do you see this do you acknowledge that perhaps there is a slippery slope here?
No, I think this is about innovation in healthcare and ensuring that we can deliver on those healthcare services that Canadians want, need, and deserve, quite frankly.
Okay. Those are all of my questions. Premier Stefanson, thank you for your time today.
Thanks very much, Katie.
For more on what we can expect, Dominic LeBlanc is the Minister of Intergovernmental Affairs. Minister, thank you very much for joining us. Are you prepared to meet the demands of the premiers when it comes to healthcare funding? They have made it explicitly clear they want Ottawa's share of healthcare costs to go from 22% up to 35%. Are you prepared to meet that demand?
Look, we're prepared to have a detailed and thoughtful conversation with premiers, as we've been having, Katie, with provincial governments and territorial governments for a number of months. We have said that we're prepared to invest additional federal resources in a public health care system that is under enormous strain. But we want to make sure that that federal investment drives better outcomes and better results for the patients and the women and men working in the system. So we're confident that there's a significant basis for what we hope can be a quick consensus. So this meeting on February 7th is the Prime Minister's invitation to his fellow First Ministers to come to Ottawa. He'll lay out a detailed federal proposal, and our hope is that we can very quickly sign agreements that can tell Canadians that all orders of government are working collaboratively to deal with the very real pressures that we're seeing in big communities, small communities, rural communities. Everywhere across the country, we're all seeing some of this strain on healthcare systems. So they expect us to work collaboratively together, and that's exactly what we're doing.
But they have made it very clear they have a specific goal here in mind. Are you willing to meet that 35% threshold?
Well, look, the 35% threshold has been a number that, you're right, they have used for a long time. I have said last summer, for example, that percentage doesn't take into account tax point transfers. So we don't think it's constructive to focus on sort of a take it or leave it conversation. This is not at all what this is going to be. This is a collaborative, collegial exercise. As I said, the Prime Minister believes, I believe, Jean-Yves Duclos believes, based on conversations we've had over the last number of months, that we can arrive at the right consensus that would unlock additional federal investments, so additional federal dollars destined for a public healthcare system that's under pressure, but in a way that we can tell Canadian taxpayers that it will drive better results and better outcomes. I think that's what they expect of their governments to do collaboratively.
Now, much of this cabinet retreat has been focused on the looming recession and the slowing economy and what is expected to be a very difficult year. How will the slowing economy affect your decisions when it comes to the amount of money the government can spend on health care?
I mean, obviously, the government's fiscal position as a function of the country's economy, of the global economy, is something that the Minister of Finance and the Prime Minister have to balance in terms of every decision. However, we certainly recognize that additional investments that will drive better outcomes for Canadians is a priority for Canadians. It's a priority for our government. So we're prepared to invest, as we've said, additional resources, conscious of the fiscal situation of the government. We're not in a fiscal position that we might have been in 5 years ago or 10 years ago. But we recognize this is an area, a priority area for all Canadians, for provinces and for our government. So we'll make necessary the additional federal financing that we think will secure for the long term a public health care system that Canadians rightfully depend on and expect to be world class.
So are you going to make the argument then that, recession be damned, we are going to spend what we need to spend to bring improvements to healthcare because the systems across this country are in real rough shape?
So that's not the way those conversations are ever phrased. It's not recession be damned. The government makes decisions on its budget based on the fiscal situation that we find ourselves in. There's no doubt that the economic situation now means that the financial capacity of the government is necessarily different than it was some years ago. But as we've said, this is a priority area for us, always has been, and we will continue to make available the resources necessary to arrive at the right agreement with provinces in a way that we think will improve the public health care system for everyone.
Ontario and Alberta both announced plans to expand services offered at for-profit clinics. Does it matter to you where or how services are offered as long as it brings down wait times?
No, I mean, obviously the provinces have an obligation to respect the provisions of the Canada Health Act, and that means that you get access to medically necessary services because you're sick, not because you have financial abilities that others may not have. So again, we expect provinces, and we're very confident that they will respect the provisions of the Canada Health Act. They're undertaking a number of ways to try and reduce backlogs, but we will continue to enforce the provisions of the Canada Health Act, and we're quite confident, based on conversations we've had and what premiers have said publicly, that they will continue to do so.
Do you see the expansion of services in for-profit clinics? Is that the future of where the solutions are going to be found when it comes to the healthcare crisis? Is that your vision for how things change and get better in this country?
No, our vision doesn't include a vast expansion of for-profit healthcare. That would not be the vision of our government at all. Our vision means that every Canadian who needs a medically necessary service or procedure has timely access to high-quality services paid for by the Medicare system, by the public healthcare system. It's not access based on your ability to pay. It's based on the medical needs that you have at a particular moment. And that is a fundamental tenet of the Canada Health Act, which, as you know, was passed by the government in 1984 and supported by then opposition leader Brian Mulroney. So we have no reason to think that governments in Canada aren't prepared to accept the basic principles of the Canada Health Act around accessibility. But provinces within their own jurisdiction have a responsibility, we think, to find the best way to bring down wait times, to improve access to the system. So we look forward to working with them collaboratively in that regard. But at no point do we think that they're about to, or that we would support something that obviously doesn't respect the principles of that Canada Health Act that I just described.
Part of the reason the healthcare system is experiencing severe challenges right now is because of a lack of staff. And we're seeing different provinces take different measures to try and bring more workers to their provinces. For example, New Brunswick is now offering signing bonuses and money for moving costs for nurses from out of province. What do you think about these kinds of tactics?
You're absolutely right, Katie. The access to health human resources is one of the real reasons that we're seeing some of the pressure in hospital emergency rooms, in surgical backlogs, and access to primary care services. Provinces have identified for us health human resources as a huge priority area. Training a particular technician or nurse or doctor doesn't happen overnight. They want to ramp up their ability to do so. That's an area where we would want to invest in collaboration with them. One option, as you say, is to recruit. Recruiting from another province might be one tactic. I've heard premiers speak to one another about what that means if you go and raid a particular professional from a neighboring province. One of the things we can work on, and I talked to the Minister of Immigration, Refugees and Citizenship about this today, is work in an expedited way if provinces identify healthcare professionals abroad, living in another country, that want to come to Canada, and then of course there needs to be a way to recognize their credentials in a proper but expeditious way. So those are all kinds of things that we can do in partnership with provinces, and frankly that'll be the kind of conversation that we should have with them in less than 2 weeks when we meet with them in Ottawa.
But what about these provinces that are trying to bring nurses and frontline staff from other provinces? Is that, you know, it might benefit one province, but it might hurt another. Is that a concern to you?
Well, I mean, the premiers, I've spent enough time with Canada's premiers, Katie, to know that they're perfectly able to defend themselves and articulate to one another their views on those kind of policies. If one premier wants to go to another provincial jurisdiction and recruit staff, those premiers can sort that out. All of the provinces are under pressure to recruit, retain, train those medical professionals. So our job will be to provide additional federal resources to plans that they elaborate for us on the way to relieve pressure around health human resources. So we think that there are all kinds of interesting ideas, and as I say, recruiting internationally some of these healthcare professionals is part of the solution, and we can use the Immigration Department to hopefully be of assistance to these provinces as well.
Minister LeBlanc, thank you for your time today.
Thanks, Katie. Hope to see you soon.